Welcome to this Fort Wayne Fire Department short. In this short, we're going to cover pulmonary embolisms. What is a pulmonary embolism? Pulmonary embolism is an embolism that travels into our lungs. So what is an embolism? Well, an embolism is a thrombus that is moving. Well, what's a thrombus? A thrombus is a clot. So this is typically from a deep vein thrombosis here. So we have a vessel in our leg, most likely, that has a thrombus forming. We have an issue when that thrombus breaks off and it's going to move along the blood vessel towards the heart, because that's what veins do. Here we have our circulating blood. We have our circulating deoxygenated blood into our right atrium, and then it's going to descend into our right ventricles. From there, via the pulmonary arteries, it is going to go to our lungs. But with the pulmonary embolism, we have an issue here. We have a blockade. This embolus has been lodged in our pulmonary arteries somewhere, creating a physical barrier so that deoxygenated blood cannot make its way into the alveolar space where gas exchange takes place. Well, that's problematic, isn't it? So how are these patients going to present? Well, most likely, I'm going to come this way, they're going to be short of breath, they're going to have dyspnea, they're going to have an increased respiratory effort and increased respiratory rate. They're going to be tachycardic to a certain extent. They will have low blood pressure, they'll have low oxygen, and one of the key points here is going to be relatively clear lung sounds. You may hear some diminished notes, but when you listen to their lungs, you might be expecting to hear something gravely abnormal, but in these individuals, it is not a ventilation problem, it's a perfusion problem. And so their lungs are going to be relatively clear. These individuals are going to be experiencing chest pain and anxiety as well. They will be pretty anxious about what's going on, and they might be very confused. And I want you to pay close attention to the history and your physical assessment. So we've gone over our assessment relatively, but let's talk about the history. Who is going to be at risk for the pulmonary embolism? Well, those who are relatively immobile, do not move a lot, pregnant patients, those taking oral birth control, and those who had recent trauma or surgeries. What are we going to do for these individuals? Unfortunately, in the pre-hospital setting, we are fairly limited in what we can do. So the biggest things are going to be gasoline, recognizing that these individuals need to be transported rapidly to the hospital, and we're not delaying transport for any reason whatsoever. And we are monitoring our ABCs, and we're taking care of those ABCs. That's pulmonary embolisms. Hopefully that provides some clarity and is helpful.